Some of you may recognize my name, and most of you probably don't, because it's been 40 years since I played high school football on the other side of the river. I was an all-state quarterback, Class 5A, outstanding offensive player in the state, recruited heavily by LSU, decided to go to Texas A&M because I thought I could probably start sooner at A&M than I could here at LSU. And so the only problem was we still had LSU on the schedule. And so whenever I start my first game at 18 and we're coming over here to Tiger Stadium to play the LSU Tigers, who are number 5 in the country, and we're totally unranked, and I'm inside LSU Tiger Stadium, and it is so loud, I can't hear myself say down, hut, hut at the line of scrimmage. And I turn around to the referee, who is not a good friend of mine, and I say, we can't hear. And it's 14-14, fourth quarter, with about 5 minutes to play, and we're down on about the 30-yard line going in. And he calls timeout, comes up, and we get to re-huddle and come back out. Well, you can imagine at Tiger Stadium, it's even louder. It's crazy. And I'm going down, hut, hut, and again, nobody can hear. So I turn around to the referee, say, we can't hear, figuring he's going to help me out again. And he says, you're on your own, boy. Tiger Stadium was unbelievable. We ended up fumbling on the next play. And they got it back, and they fumbled on their very next play. And so we ended up, I missed a handoff, ran for about 20 yards. We got down to about the 5-yard line and ended up putting it in. And it was a huge victory for Texas A&M. 21-14. We went from nothing to number 7 in the country. We sold more season tickets that following Monday than at any time in the history of the school in one day. And that was kind of my indoctrination. The year before, which is why I went to A&M, was to start as a freshman, which I couldn't do. Most of you remember the name Burt Jones, and Burt was graduating from LSU whenever I was about to go in. And so they had 2 really good quarterbacks coming back, Mike Miley and a kid named Broussard from Jennings. And so I thought I had a better shot at A&M. The only problem, like I said, was that, we had LSU still on the schedule. Fortunately, we won the last 2 games, and then the LSU A&M seasons ended for 11 or 12 years, and then picked up again. And of course, now we're all in the SEC. But whenever I come back to Sulphur, which is, of course, a wonderful place, and I love it dearly, I always remember that I want to bring 3 things back. Do we have anybody from Sulphur here by any chance? Golden Tours? Not a single. There's one. There's 2. Okay. The guys who invited me here. Thank you, Chase. All right. I always bring this back right here. SHS Tornadoes. And then, of course, I had a very good friend of mine buy me this years ago, number 8. Of course, you see the colors of this jersey, LSU Tigers. I have a cup here that has McNeese on it. And then just a couple of weeks ago, we were at University of Louisiana Lafayette for the Ole Miss game. Evelyn, my girlfriend here, is a sports writer and photographer for Ole Miss sports through the NCAA. And as many of you know, Ole Miss is now playing in the World Series. So we've got that game coming up at 2 o'clock, which is going to be a lot of fun. And if they happen to win today, we're on our way to Omaha to watch the final game tomorrow of their bracket anyway. That's a little bit about me. I did suffer a few injuries when I was in college that were very difficult. It's a little hard to talk about because even when it's 40 years ago, it's still weighs on my mind quite a bit. And particularly because everybody here is a health provider, I always felt like there's a interdisciplinary team that should always be involved whenever you have an injury, particularly in high school or in college or any amateur level sport. This is just a little bit about me. Graduated from Sulphur High in '73 at age 17. Signed to play with A&M, became youngest starting quarterback in NCAA history, and I still hold that record. Named Freshman of the Year by the coaches in the Southwest Conference, finished my career at A&M as the winningest quarterback in school history. Still number 2 in that regard. Coached football and taught algebra for a decade. Suffered a broken neck back in 2010. And last year was inducted into the Sulphur High School Hall of Fame. We've never had a Hall of Fame at Sulphur, so I was very honored, of course, to be included in that group, along with another Aggie, actually, Dr. George Hardy Vincent, which was very cool. Injuries that I had at quarterback. Sprained knee in 1974 against Baylor, sternoclavicular dislocation in 1974 against SMU. I had hamstring pulls. Let me talk about hamstrings real quick. We just had a player from the USA World Cup soccer team who suffered a really bad hamstring. Hamstrings are very difficult to prevent. One thing I found out whenever I was playing was before these hamstring pulls occurred, I had spent the whole summer working very diligently and every day working on stretching routines that would help me get more limber. And I'd never had a hamstring pull before, but I had teammates on the A&M team who were really limber. I mean, they could just touch their noses to their knees with their legs straight. I couldn't do that. I couldn't touch the ground with my knees straight. And obviously I was a pretty good athlete, but there just wasn't anything I could do. And we had about, in our extensive stretching routine that we did before every practice and every game, we had a lot of hamstring stretching exercises. And what I did is I went past the limit during that summer. I went further than my muscles wanted to go, thinking that I was doing the right thing. It turned out my very first practice that I got back, I pulled my right hamstring, and I couldn't run. You know, there's a difference between pulling a hamstring and tearing a hamstring. I'm sure this was just a pull, but then I turned around a week later after I came back, and I pulled my left one. And all this, I'm sure, occurred now after I got back and got to doing things a little bit lighter. And what I learned from hamstrings is to only stretch to where your muscles begin to feel the stretch. And once they begin to feel the stretch, you don't need to go any further. You just don't need to go any further. And I took this idea, I took this revelation through with me through the rest of my college career, and never again had a problem with a hamstring. Had a hyperextended knee, which is, of course, when your knee is straightened out too much during the spring of 1976. It's not a tear, it's nothing serious, but it is something where you want to shut her down right after that, which I did. Concussions. In high school, I had a couple of them. When I was a sophomore, I remember waking up on the ground in a junior varsity game over at Little Cypress, and coaches and referees were telling me not to get up, not to move. And to this day, I can't tell you whether I was on offense or defense. I don't know. I went to the sidelines, I sat out for a little while until my head cleared, and I went back in the game, finished the game. I played both ways then, so again, I don't know if I was in on a tackle. We didn't film games back then in JVs, so I don't know if I was in on a tackle or whether I'd been sacked and hit or whatever. The next year we're playing Lafayette, and I got hit. I got knocked what I always call dingy, and I was sitting on the bench with my parents in the stands, and I just went over. I just went over to the right, and I just lost consciousness. And at that time, I was just playing defense, and of course, scared the heck out of my mom. And then, of course, in college, yeah, I got knocked dingy a lot. We were playing Washington, and I remember after the game, I'm talking to the sports writers, and they're asking me about the specific plays of the game. I said, I really can't tell you. I don't remember. I don't remember that play. I remember the final drive, but the first 3 and a half quarters, I don't remember. There's always, and now we're finding out more and more about concussions that are really scary. I've got a very dear friend of mine named Mike Mosley who replaced me at A&M at quarterback. He went into the NFL and played several years at wide receiver. And he's having just all kinds of troubles right now because of concussions, which lead to dementia, which lead to depression, which worries me to this day about what he may do at some point in time. The other one I have that's up here is that my left pinky was torn out of its capsule. And what they said was by tearing it out of its capsule, I was making a regular, normal handoff, and somebody got penetration and hit my hand at the time of the handoff and just at the mesh point with my running back. And I pulled it out and shook it, but it didn't hurt. And I didn't even know it was hurt until the very next play we called a pass, and I dropped back to pass, and I felt my little finger, being left-handed, I felt my little finger sliding down the football. And so when I tried to throw, and this was against Texas Tech, Bill Parcells, who a lot of you know, happened to be their defensive coordinator in that game, and it was the toughest defense I'd ever played against. And I felt my little finger just slide down the football. And I threw a duck that went about 10 yards short of the receiver, and it was all like this. Well, the very next weekend, we had to go up to Ann Arbor and play Michigan. At the time, Michigan was number 2 in the country. We were number 4. National TV, big game. And I'm warming up before practice, and I'm throwing the football with 3 fingers. The only thing that we could do for that little finger that was just hanging down to here, all I could do was personally, because it was so painful to touch, was to tape it up. And there are pictures here that we have. Tape it up about the same distance as I would if I were passing a football. But it was essentially useless. I threw a couple of interceptions against Michigan. We did not win the game. It was what some sports writers called the biggest embarrassment in the history of the Southwest Conference. And didn't go down well. That was my senior year. We had a couple of weeks off before the next game, and I was able to get it a little bit of the strength back in it. But for the remainder of the year, I just had to tape it up before every game and every practice. And I had to do it myself because it was just so painful. If you caught it on a piece of cloth or anything like that, it would just, I'd cuss. I'd cuss loudly during practice. We did try one thing that was, I think, kind of special. The Thursday night before the game, my offensive coordinator came to my dorm room, and he brought with him a gentleman from the psychology department. And what they wanted to do was hypnotize me and make the pain go away. Okay. Well, you know, it's 1977. I mean, we're going to try everything we can, right? And, you know, believe it or not, for about 15 minutes, I could move it and I didn't feel any pain because I was very receptive to doing whatever we could to get this thing taken care of. But we did. We tried hypnotism to relieve the pain. 1977. And again, I just went over it was just unbelievable. Couldn't grip the football, and we ran a lot of triple option at A&M, so there was a lot of this and this and this coming down the line of scrimmage. And one of the big plays at the Michigan game was a simple option play, and I was just going to fake and pitch, and the ball on the 5-yard line. and the ball just drops from my grip. And we're ahead 3-0 at the time, about to go up 10-0, about to win this game because we'd won. We were on a 10-game winning streak at the time from the previous year. We were very, very good. And the ball drops, they recover, they go 80 yards, 90 yards, score right before halftime. And then that's whenever they kind of put it on us in the second half. Again, an injury that, I'm sorry, we took a little bit of an x-ray right here just to see my little finger, my left finger, and that's what it looks like today. But everything in here was just torn apart. I don't think anybody on our training team, our medical doctor, anybody like that had seen what they were looking at here. Like I say, when I came to the sideline, it didn't hurt. All I know is I could not grip I could not grip a football anymore. This almost ruined my career. From what I've read, it's very rare. Sternoclavicular joint separation, dislocation. We were playing in the Cotton Bowl in 1974, my sophomore year. We're number 3 in the country. We're playing against SMU, who we had beaten 45-10 the previous year. We were a great football team with the number 3 team in the defensively in the country. And second quarter, I'm going down the line of scrimmage on the fake, and I get hit, and I go down on my left shoulder. And back then, we had AstroTurf, but the AstroTurf was a cover for cement. It was green, and it was carpet, but there was no cushion. In fact, I went out there. It was much worse than what we had at A&M, and I always felt that I enjoyed going to LSU because LSU always had grass. We went up to Virginia Tech, and Virginia Tech was a lot of fun to play on because they had grass. Everybody else that we played against had artificial turf. The worst that I'd ever played on was in the Cotton Bowl in 1974. So I came back in before the game started, and I pulled elbow pads up to my knees to protect my knees because I did not want anything happening to my knees whenever I hit the turf. Again, I got hit on about every play. That's the way option quarterbacks do. I know all of you probably know about the sternoclavicular joint. It's the clavicle that connects with your sternum at this joint right here, and it makes you be able to do all the rotational needs. It's something you never have ever given any thought to. But mine got knocked on that hit, got knocked up. My whole clavicle got knocked out of the joint there, and it rearranges your whole shoulder system. And it came up through the ligaments that hold the clavicle into that joint with the sternum. And so whenever you get hit like that and your clavicle with enough force comes up through and out of the joint from the sternum, you can imagine the pain that would cause. I came out for a couple of series, had the trainer look at it, had the team doctor look at it, and I was in terrible, terrible pain. But it was a game, see, that we had to win. So they sent me back in, and I played best I could. I threw the ball best as I could, which was about 30 yards as far as I could throw it. And we ended up losing that game to SMU 18-14. The best way I can describe this is there was the game Johnny. Everybody heard of Johnny football? Okay. Johnny's a great kid. I don't care what anybody says about him, what anybody thinks about him. He's got a little wild streak in him. I think he's got a little independent streak in him. But I went out and met him during spring practice. He was yes, sir, no, sir. It was, glad to finally meet you and all this stuff. Just couldn't be a better kid. But this past year against Auburn, he got hit pretty much like I did, and he got piled on like I did at SMU. Of course, the turf is much softer now. There's much more cushion. And I have a little video of what happened during that game, which knocked him out of the game. He actually had a little small separation on the corner here of the shoulder. And Evelyn and all her PowerPoint wisdom put this together for me. With the help of Lauren, thank you. Y'all did a great, great job. Right there. See that right there? That's how I went down, except I went down on cement. Johnny went out of the game. I mean, he didn't come back in, and even though we were down on the 2-yard line, we didn't get any more yards. Ended up having to kick a field goal, which I don't think we'd have done if Johnny's still in the game. And Auburn ended up coming back and beating us in that game, which of course catapulted them into the national championship game against Florida State. I don't think if if he doesn't get hurt, then we probably win that. A&M probably wins that game. And I was really concerned whenever I saw that, sitting at my house watching the big screen, because we really can't afford tickets at A&M anymore. Although we did go to the Alabama game, it was just hard to see, because I was really worried that if he had a sternoclavicular dislocation or separation, his career was through, possibly. For sure, his year was through, because how many golfers do we have in here? Okay. The thing about golf is whenever you get one of these things and everything changes, you can no longer play golf. I'm a right-handed golfer, all right? My swing since I've been 18 has been here. That's as far as my backswing can go. So when I have tried to play golf, I've had to use a split grip. And of course, there's no guarantee where the ball is going with a split grip. You have no idea. And then the next day, my left shoulder would be killing me. What we ended up doing the week after the SMU game, because all we had to do is win our next 2 games, and we were still conference champions, and we were still going to the Cotton Bowl. This is a picture right here. If you look on the diagram on the right, it's like a mirror image. And we're talking about anterior SC separation here, as opposed to the posterior, which is obviously, as you know, very, very dangerous. I mean, it can go into the trachea, it can cut arteries, it can kill you in a matter of minutes. This was what I had, was the anterior sternoclavicular dislocation. This is what my trainers, this is what my team doctor, and this was just taken a few days ago. This is what they saw the next day when I came to the training room. And the diagram on the right is very, very telling in terms of what we're looking at in terms of a sternoclavicular separation / dislocation, when the interior edge of that clavicle just completely comes out of the joint. This is what I look like to them, okay? And what I look like now. You see the big lump, you see the direction of the collarbone from the left to the right. Remember, it's on the left-hand side that I was hurt, which was my throwing shoulder. That's a career ender, you know, as far as I'm concerned. The pain is just unbelievable for months. I did not work out. I could not lift weights. The following spring, I couldn't do anything. Here's a little better view. You'll see on the left-hand side, see the huge bulge on both clavicles in the joint there. near the sternum. And if you'll notice that one, particularly the one on the right, where it's almost up to my Adam's apple. So you can imagine a kid, an 18-year-old kid, scared to death, hurting like heck, coming into the training room the following Sunday. And what they did was told me that if they could have found me the night before, which I still don't understand because I got off the same bus everybody else did. If they could have found me the night before, they'd have sent me to our team chiropractor. And our chiropractor could have taken care of that night. So now all of a sudden it's my fault. And all I did was go home and go to my room and go to bed and try to sleep. You couldn't lay on that thing. I mean, think of everything that has moved, during that accident. Think of everything that has been torn. Think of the ligaments that have been torn and stretched. Think of everything just going this way and now up under your Adam's apple. And they told me if I'd have gone to the chiropractor the night before when we got back, he could have fixed it. So what do you think we do? We go straight to the chiropractor. And he tells me, I can't do anything for you. He wouldn't even touch it. The subluxation that's supposed to take place, that can take place, that's sitting up here, where they talk about the things that you can possibly do that might repair it if you can get it back into the joint. None of that took place. All right? We had 2 games left to play, folks. And if we win both of them, we're in the Cotton Bowl. And this is a pretty huge deal at A&M. Since they hadn't been in the Cotton Bowl in, 8 years. So none of that stuff on the left happened. I show up for practice the following Monday. I'm throwing the ball like this, as I refer to in my book. And I'm not telling y'all anything that's not in my book. But everything in my book, I'm not telling y'all. You know what I'm saying? But the next day, I'm throwing like a 6-year-old little girl. And the ball is going about 5 yards. This is as high as I can raise my arm. And the head coach just stares into the distance. And so I'm wondering, well, what's going to happen? I mean, I can't play Saturday. I can't play against Rice. What's the deal? Well, I show up Saturday, and they take me into the trainer's room. They draw all the shades. And the doctor comes in and tells me, this is without benefit of any x-rays. This is nothing. And he tells me that I have a bruise, that this is a bruise, that I was hit straight on. And I'm saying, doctor, I said, I fell on it. I fell on the end of it. I did not get hit from the front. I played for a guy named Shannon Suarez in Sulphur. Shannon used to tell us, you got $300 worth of equipment on, son. A bullet can't pierce it. And I still remember that. And they're telling me that I got hit straight on and that this is a bruise. And that cortisone will help it heal. So, before the Rice game, that very next week, I get injected here, 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 and here. All 4 directions. They're pulling that needle out and they're putting it back in. Because my shoulder hurt so bad from trying to throw during the week, I either had a rotator cuff problem or I had another separation right here. That's where the next injection went. And I went out to play against Rice. We beat Rice. I had 1 carry. I had 1 pass. All they wanted me was out there to play. That was their solution to a sternoclavicular separation / dislocation. Severe pain in the shoulder and clavicle for months, inability to move the shoulder. Had to keep my elbow right here. I could not drop my shoulder. When I wasn't shot up, I couldn't drop my shoulder. All week I went to classes like this because if I moved my shoulder, it hurt. It hurt. And again, it's a bruise. And again, this could all be fixed if I'd have just gone to the chiropractor. Okay? Now, after we beat Rice, what happens? We've got the University of Texas coming up on Thanksgiving Day, you know, the big woo-woo, the one that's on national TV, the one that we have to win to go to the Cotton Bowl. Okay. I don't want to be too negative here, all right? But this is one of the reasons I decided to write the book. Ethics is so huge. And here I have what I feel like should be the team that gets together whenever you have an injury. Okay? Family, physicians and therapists, trainers, coaches, and the player. Everybody should be involved in that. Everybody should be involved in what the adjustments have to be, what the goal is, what the plan is. And then they have to communicate that to the player to get the feedback and to his parents. All right, we're about to go play Texas. My parents still haven't got a call. They're in Sulphur, 200 miles away. Back then, long distance cost a lot. So I can understand why Texas A&M wouldn't want to call them. It just, I mean, if you didn't get on the toll-free line, I mean, it cost some money. You know, I used to go to telephone booths and put quarters in to call home. You know, because it was against NCAA rules for anybody to go up to the coach's office and use their toll-free number. So my parents were never notified. We had no idea this was going on. I went ahead and played against Texas. We fumbled our first 3 plays. Before I went out there, I got shot up. I was standing on the sidelines before the game, before I was supposed to go out, and I almost passed out. I'm not a big needle guy. I look at a needle kind of, you know, bothers me a little bit. I almost passed out while I'm standing on the sidelines. We're on national TV about to play the University of Texas in the biggest game A&M's had since World War II. And we go out and fumble on the first play. They score. Fumble on the second play. Lionel Johnson from Winfield, Louisiana, who I played with at the Louisiana All-Star game, returns it for a touchdown. We fumble on our third play. They kick a field goal. It's 17-0 with 2.5 minutes gone in the game. And then I throw 3 interceptions. 3 balls that were nowhere close. There was a trainer after my book came out, and he was talking, a former trainer, I should say, a former student trainer when I was there, head trainer after I left, who had this to say, and I didn't know this for a long time after he posted it. As a person who worked directly with David Walker on a daily basis when he was an athlete, let me correct a few things posted here with facts. And what these people were doing on this forum, we're talking about my book. He did not have a broken collarbone. In fact, his injury was in the same room as Cyrus Graves last year on a severity scale. Sci-Fi missed the T-SIP game but was cleared for the bowl, just chose not to play. Walker had a sternoclavicular separation. That's where the collarbone connects to the sternum. Put your chin against your chest, and that is where the point is. The injury occurs most often when a ball carrier is tackled and one shoulder hits the ground, and then a big fat-ass lineman falls on top of them and compresses his shoulder side to side. Imagine a wishbone QB on the keeper getting planted by a big tackle or end. In the business of football, this is considered a pain tolerance injury, meaning that if a player is tough, they go with it as there is no risk or damage other than what has already occurred. This is, I'm an algebra teacher, I'm putting this together real quick, 36 years after the fact, and this is still his story. If you listened to College Game Day on Monday, you heard Kurt Herbstreit talk about Barrett Jones getting a little help from the doctors so his sprained foot would not bother him during the game. Walker got the same help, has had thousands and thousands of college athletes over the years. And then to quote RG3, well, if you've never been there, you know, blah, blah, blah. This help. This help. I thought I had a pain tolerance injury. If you got a pain tolerance injury, then you can play. If it doesn't hurt too bad. What's this help all about? I swear, when they brought me in to give me that shot, I said, hey guys, I've had my flu shots. I had my B12. What is this? It's going to heal it. It's going to heal it faster. Don't you want it to heal faster? Yeah, heck yeah. That's the way things were done. And this is how a former athletic trainer responds to what I've just shown you. It's crazy. So the following week, we played Rice. And this is what happened at Rice. We won the game very easily. But you can see right there, I get hit pretty good after I make the pitch. This next one is that Texas game I was telling you about. That was the first fumble. It was 20 degrees chill factor that day. And then this is the one Lionel returns for a touchdown against us. And I'm going to try to make a tackle before he gets there. But again, as I said, this is the one I was almost passed out on the goal line, on the sideline before the game. So I'm taking this kind of punishment. And of course, you know, the cortisone had taken care of it. You know, it didn't help. So the following spring, I'm benched. The following spring, I go from first team to third team all of a sudden because we didn't win the big game with David Walker at quarterback. He's the reason A&M didn't win the national championship. He's the reason we didn't go to the Cotton Bowl. And all of a sudden, I go from first team down to third or fourth team. I don't know. I'm put on the other side with the scrubs in the spring game. And we go through the next season. We start off 10-0. We go up to Arkansas. We're number 2 in the country. All we got to do is beat Arkansas up there. We'd already beaten Texas, and they kill us. And because our backup quarterback, I didn't even go to any of the games. I was up in the stands. I mean, they told me to get out of the dorm the night before the games. They told me I wasn't welcome. Go find a place to stay. I was the first red shirt ever at Texas A&M, and you know, of course. In 1972, the year before I got there, was the first year freshmen were allowed to play varsity sports. So I was the first redshirt at Texas A&M. They told me it wasn't that I couldn't play, it's just that they didn't really, they were going a different direction. Well, a wonderful thing happened after that 75 season, and this is the point I want to get to. They gave me no rehab, no therapy, nothing. They were sticking to the story that if I would have gone to the chiropractor, I'd be okay now. They did send me to the head of the PE department, and he had me lift my arm a few times, once a week, and then that was the extent of my therapy. I don't know whether nobody knew what to do about this injury or whether they just didn't care. But the next year, I find myself sitting on the bench. I find myself trying to find a place to stay on Friday nights. I find myself up in the stands. Or I find myself in San Antonio with a girlfriend of mine watching the games on TV. The following spring, we had, I walked by our dilapidated little old weight room that we had, that I had never lifted a weight in because I was too hurt to do so. And I see these new machines. And I happened to sit down on one of them. And they're Nautilus machines. And I start going through the full range of motion of the pull over, and then the pull together, and then one where you pull down, and then one where you lift up. And it's killing me, guys and ladies. It's just killing me. It's killing my shoulder. It's killing my sternoclavicular joint. It's killing me. But something told me that if you just keep at it, this is going to take care of it. This is going to heal you. Now, back then in 73, 74, 75, there was a huge confrontation between universal weights and Nautilus weights. They did not like each other at all. Universal is what we used in high school. Universal is all we had at A&M. Okay. The guy from Universal said, there's no way these weights in any way can help an athlete because they don't have that power. They don't have that thrust that you got to have. I disagree. These weights saved my career, and I did it all on my own. I did it with no help. I did it every day, every day. The following spring, I hadn't moved up the depth chart. I left school. I signed with Louisiana Lafayette, which was USL back at that time, where my daddy graduated. And that's where I was going. Then a guy named R.C. Slocum came to my house a week before practice was supposed to start at A&M. He was defensive end coach at the time, graduate of McNeese. And he sat down with me and said, all the coaches except for my head coach wanted me to come back. I went back. I decided, okay, well, at least I'll graduate from A&M and the ring and all that. But these machines right here saved my career. I did beat out the guy again. I did take over. I did start 17 more games for A&M. I did become the winningest quarterback in the history of the school. Second and number 2 in total offense all time. Did good, but had to go through this ordeal to get to those points. And then there's the neck. All right, this is the one injury that, folks, I hope you never see. I rolled my Jimmy coming down a hill from a friend's house, and the first thing it hit was the back of my shoulders and my neck. I didn't have my seatbelt on. I hadn't hit the main highway yet. And I was looking at my phone. I was texting. I was trying to find Mike Mosley, was giving me his address, and I was going over to his place to see how he was doing, the guy with the concussions. And when I looked up, there was a set of trees. I hit hard to the left, and then it took another quick right. And I took a hard, quick right, mid-size SUV. You know, you've always heard about them. Well, I started rolling. And the first thing it hit was the back of my neck and the back of my shoulders. All right, then after it finished rolling, I'm laying on the passenger side looking up at the stars. All the windows are gone. All the tires are busted out. Total. And I start thinking to myself, well, you know, what if I'm in a football game? How, you know, for some reason my mind said, what would I do? And my right arm was a little bit paralyzed. My left chest felt hurt. My neck didn't feel normal. But anyway, I climbed up. I grabbed the steering wheel, climbed up, and I got out. I had some friends of mine who were following me. They called the ambulance. The ambulance gets there, and I say, no, I don't need to go. And they said, no, if you're having trouble with your neck, you need to go. So anyway, I went to the hospital, told them I didn't have any insurance. So they did a CT scan. CT scan came back negative. So I said, well, good. At least I don't have a broken neck. I just got a stinger. I just got a crick in it. Again, pain tolerance, right? Okay. When I went to see 4 months later, after I'd written my book, after I'd sat down at a desktop and typed with 2 fingers this book, I decided to go see my chiropractor. I told him what had happened. The chiropractor told me that, yes, hold on a minute. I said, I just need an adjustment. I just can't get my head out of this situation, out of this right here, and I can't get my shoulder down, but I'm sure with an adjustment that I'll be okay. Well, he took x-rays, and this is what showed up. And if you'll see, everything is fine up until the C4 and the C5. They are totally dislocated. He told me he didn't know how I was standing there. Wanted to put a neck brace on me immediately. This is me at my daughter's ring ceremony at Texas A&M whenever they get their senior rings, which was a couple of weeks later. I said I can't do anything until my daughter's ring dunk. And this was my posture. This is what I had walked around with for 4 months. Because I believed the CAT scan, and I believed the doctors. I believed what they told me. I believed that it wasn't anything but muscular. And as you can see, my head's tilted to the right. My right shoulder is up here. My right arm, I couldn't even pull over a seatbelt. I couldn't snap a seatbelt. And I was thinking, this ain't normal. So after I went to see the chiropractor and he took that x-ray that you just saw, I went in to see an orthopedic surgeon in Houston, Dr. Jose Rodriguez. This was when he first saw the x-ray, he got sick to his stomach. And his old joke was, when he's showing this to people, what is that? Is that a quad? He said, no, just an old Aggie quarterback happened into my office one day. And as you can see, you see where the bones are pressing up against the spinal cord right there. I mean, it was tight. And he put the halo on my head. And they took me in and laid me down for 7 days of traction. And told me I wasn't getting up until they could move those bones a little bit further back, because he was going to be unable to operate until he got those bones moved away from my spinal cord. Otherwise, he could paralyze me during surgery. And that really didn't work out well. It didn't move them hardly at all, because they'd been stuck like that for 4.5 months. We went ahead and did it after he'd gone to Orlando to a clinic, and he'd shown my pictures to everybody and got some advice and what we were supposed to do. And for those 2 weeks that he was gone, I was in a halo and walking around. If you've seen anybody in a halo, I mean, it's not comfortable, but they do have the springs and everything where you can lay down and sleep and do all that kind of stuff. And I still remember waking up in the after the surgery, and my daughters and my sister being there, telling me, Dad, everything went okay. Everything's good. And the first thing I could do was just move my fingers. Because the whole time that you're in there, if anybody has ever been in one of those places, the Spinal Institute in Houston, all you see are people in wheelchairs. When I went in the morning before for all the blood work and everything before the surgery, the lady, they were having trouble with my halo, and she came in and she said, oh, I do this all the time with quads, where we're having to reteach them how to swallow. And the toughest thing about everything was that I have trouble swallowing. I can't swallow. I can swallow a chicken leg okay, but I can't swallow the breast meat. It just sticks in there. And I don't know if that's ever going to be any better. But I guarantee you it beats being in a wheelchair. I guarantee you it beats being a quadriplegic. So if you ever have a kid who's complaining of neck problems, listen to them. I'm living proof. I am the medical marvel that a football player, particularly a very competitive person, would do anything to get back on that football field. SC joint, broken neck, whatever. Can you just imagine? I was going to go to a weight room and get on a neck machine to try to fix this problem. I would have crumpled to the ground at the moment I did it. It's a very dangerous sport, football. I had 2 girls. One's a traveling ICU, cardiac ICU nurse. She's up in Seattle right now. My youngest was the president of the psychology club at A&M. Before she graduated, got married, went up to Oklahoma City. And just 2 brilliant kids. She was a soprano 1 first chair, Class 5A, state of Texas. And I'm very, very fortunate that I didn't have a boy. I got to go to basketball games all the time. I got to go watch chorus. I got to do the fun things that you didn't have to worry about these type of catastrophic injuries. And just take care. Just take care. Take care of the kids. Stay in touch with the folks. Let them know what's going on. Don't let a coach talk you into something. It's just not worth it. It's not to anybody's benefit except the coaches. And you know, players don't win games for coaches. They win the games for each other. And that's really what's important. I think that's all I got. I want to thank everybody for having me here. Memorial Hospital is where I was born. It's where I took my first breaths. I would do anything for them. And I'm just so happy I could come here and share my story to such a wonderful group of people. I was in the work hardening and physical therapy business for years in Houston. Work Ready was the name of the company. And workers' comp was primarily how we were paid. And so I just, you know, I got a special spot. I really believe that the kids out there need to be taken care of. Even after they've graduated from college, if they have injuries, they should be repaired. And a lot of times colleges don't do that. But love you, love what you're doing, love that you're helping the kids and the people, their parents and everybody else. Just keep doing a great job. Thank you very much.